What's up, everybody? Back in action. Happy Monday. Getting this thing fired up. We in it, though. Cool. Looks good here. Cool. Good evening, everyone, and welcome back to Know Your Pharmacist, your weekly dose of health enlightenment. I'm your host, Dr. Joaquin Acosta. Tonight, as we step into November's crisp embrace, we're illuminating the path to lung health and exploring how, amidst the Norco struggle and the Norco shortage, cannabis is sparking conversations on alternative healing. Every breath reveals a story of resilience, and as we delve into Lung Cancer Awareness Month, we'll unwrap the narratives that bind us to our collective health journey. We'll also explore the intimate dance of fatherhood and health, sharing insights from my own life that hopefully can connect us all. Join us as we collaborate, brainstorm, and most importantly, guys, connect, because here, every voice strengthens the heartbeat of our community. Let's ignite the flames of knowledge, compassion, and action. Together, guys, we'll discover, learn, and inspire. Thank you for being here, for your energy, your curiosity, and your compassion. Thank you. Let's knock this out and get started on a healthier tomorrow. Also, big thanks to our show sponsors, Farm True, Vado Speedway Park, The Bake Chicken Farm, and High Horse Cannabis Company. Guys, you guys make this absolutely and entirely possible. As you all know, I became a father last Tuesday, Halloween evening, right before I was about to go live. Between lives, it happened. So what a blessing. Little Amelia's out here in the world, and welcome to the Carney Show. So we like to say it's a great time, and I hope to make it a better place for her as well as everybody else as well. And we're back here this week celebrating and learning, right? Celebrating the celebration of life and learning so much, guys. Being a new father, obviously, a lot to learn there, as well as all the things in the pharmacy world and the cannabis world and the world that we just have continuously going on. So let's talk about that today. Lung Cancer Month, Awareness Month, guys. It's Movember as well. Men who are growing out their beards or mustaches in awareness of prostate cancer. We'll get to that as well throughout the month. But starting here on Lung Cancer Care, since I haven't been around for about 7 whole days since last Monday. It's my November start for y'all. Let's talk about how pharmacists are involved in lung cancer care and so on and so forth, because, guys, it's a very important notion to get into. And let's jump on in for you right here. Let me show you from the New Mexico Department of Health. Let's make this New Mexico specific to start out for you guys. Cool. So New Mexico offering support to tackle lung cancer and nicotine addiction during Lung Cancer Awareness Month. Well, of course, New Mexico offers that support, but New Mexico pharmacists, many of them can actually prescribe tobacco cessation and offer just as great as support. But on top of this, right, I appreciate the New Mexico Department of Health being a more aggressive here in lung cancer. Lung cancer, guys, we know it's a huge cause of death in men specifically, right? But how can you actually cut nicotine out of your life? Of course, 1-800-QUIT-NOW, talking to your doctor about it, going online, things like that. It sounds so much easier said than done, and I completely understand there, but always worth acknowledging, especially in times like this where we are talking about the impact of lung cancer and how to prevent it, right? Teens Live Vape Free, a text-based program with one-on-one coaching, live text support, and interactive content to help them quit e-cigarettes. Teens can register at Vape Free at this number here, 873-373. I'll put that in the comments. I think that's a great notion for teens, because as we do look at our teen vape crisis here, that is a huge thing that we really need to continue to address here in our communities, because it's a plague, it's an epidemic, and it's a problem. But other than that, what do pharmacists do, guys? How can you actually look at pharmacists being, on the forefront of patient care? That's what we're segueing into and talking about here. Pharmacists being a vital member of the cancer team, but also where do oral therapies and other parts of the community pharmacist spotlight there really actually, hold some weight? Well, very, very interesting. So again, interesting here, information from Pharmacy Times in 2021, large national study focusing on patients with non-small cell lung cancer underway that may help better define the expanded role pharmacists will play in patient care as more oral therapies are approved. So this study, My Lung Consortium, or Molecularly Informed Lung Cancer Treatment and Community Care Network, observing 12,000 community-based patients with metastatic NSCLC over a 5-year period, in one of the first collaborative researches in the lung cancer endeavor. So where is that, a huge role for the pharmacist? Well, pharmacists helping not only to recruit, but looking at adherence of medication over 5 years. Who's better than the medication specialist to look at medication adherence? And so when you're looking at pretty much every disease state ever, guys, whether it's type 2 diabetes, lung cancer, all these outpatient therapies, pharmacists are the ones who are monitoring that. Your pharmacies are the ones that are coordinating that with the caregivers or with the healthcare providers and the family members themselves, or the patients, right, among insurance companies to get it paid for. So, looking at lung cancer and where pharmacists really play this role. So not only in prevention, right, guys, but we're looking at actual cancer treatment there being a big part, and not only in the community pharmacy, but again in your oncology setting as well, whether you're in the hospital or not, guys. And the pharmacist's role does continue to grow. So if you haven't talked to your doctor about tobacco cessation and it's something that you may be interested in, or that somebody close to you may benefit from tobacco cessation, whether it's patches, gum, right, prescription medication, or a combination of it all, is a very important thing that will prevent lung cancer and a lot of other comorbidities down the road. And big thing here during November being Lung Cancer Awareness Month, to really figure out how to lean into your pharmacist and the role there that they play in this whole entire thing. So let me jump into Tech Talk section so we can look at a little bit more of what I'm getting at. So here, pharmacy shared resources for the VA, guys. I like this one because when you're talking about tobacco cessation, this is a tobacco cessation training program. And this is for patients and caregivers alike, and not, all people get to go through the tobacco cessation training. Granted, you got to get CE credits if you're going to be doing it, things like that, to be doing it here in the state of New Mexico. I don't know what other states exactly allow for it or not, but check this out.
Hi, I'm Dr. Vivek Murthy, and I serve as Surgeon General of the United States. When you think of the Surgeon General, your mind might go first to the warning label on the side of a cigarette carton. That's because for more than half a century, my office has led the effort to educate the public about the hazards that tobacco poses to the health of individuals, as well as the health of entire communities. And we've made incredible progress. One of the most significant public health successes in modern US history has been reducing smoking rates over the past half century. Unfortunately, though, tobacco use remains the #1 cause of preventable death, disability, and disease in the United States. And the COVID-19 pandemic further revealed its dangers. Tobacco use has been associated with more severe symptoms, disease progression, and outcomes in those who contracted the virus. So it's more important than ever to accelerate our efforts to tackle the threat of tobacco use. We've seen a lot of success through our public education efforts. But when it comes to addiction, PSAs and fact sheets aren't always enough. That's where you come in. Clinicians of all disciplines can help empower patients to quit for good. Research, medical advances, and years of experience have all given us the tools to help patients become tobacco-free. And while it's true that most of these attempts will not succeed at first, we know that with continued support, people can quit tobacco use for good. We developed this program because we know that right now, too few clinicians are equipped with the knowledge and skills they need to effectively assist their patients, and even fewer clinicians routinely address tobacco use in their daily clinical practices. This program will equip health professionals, students, and practicing clinicians with comprehensive, evidence-based strategies to assist their patients with tobacco cessation. We need clinical interventions for smoking cessation if we want to stop the devastating effects of tobacco on public health. That means every patient encounter matters. Whether you're a physician, a nurse, a pharmacist, or serve in a different healthcare role, you have the power to encourage tobacco users to quit and empower them with resources they need to follow through. And if the general public also supports these efforts by encouraging tobacco users to quit and guiding them to appropriate resources, I believe we can make tobacco-related disease a thing of the past. And I also believe we can then work toward a future where we can all breathe easier and live longer, healthier lives. So with that vision in mind, I welcome you to this Tobacco Cessation Training Program. Thank you for joining us in this mission to make our country tobacco-free.
So pretty cool right there, guys. Basically looking at all that, making the country tobacco-free, trying to get through that. You know, it's a very important initiative. Having a little bit of minor technical blips here. Give me just a moment. Hope everybody's doing well. We are good here, minus whatever the heck is going on. Sorry, give me a second. Well, it's super odd that we're going to have to relaunch, but it is what it is. Be right back, everybody. Sorry. Anyways, jeez, how frustrating. Anyways, we are through that, guys. My bad for the technical difficulties. This is going again, and we're back on it. Now, where were we? We're jumping into our Enlightenment Hour, guys. And in our Enlightenment Hour today, we are talking about the results for the Pharmageddon. Again, the aftermath of Pharmageddon. What does that mean for everybody, all of us here in, the world? Well, I think it's important because, again, Pharmageddon was an ongoing response, guys, as we were going to be covering last week. We only really got to cover day one, but there's a big war between, again, corporate pharmacy and their employees, their customer base, and everybody that they affect, every stakeholder. CVS just recorded literally record profits last quarter in the midst of all this, which is the most ironic thing, and their billions of dollars got even bigger, right, within all of this, on top of the fact that they're simultaneously reporting, that them and Walgreens didn't, they were not affected at all by the Pharmageddon, according to them, being pharmacists or pharmacies wanting to walk out, with teams staging walkouts last week, Monday, Tuesday, and Wednesday, in response to the walkouts in September and mid-October that were not heard, asking for more staffing hours, so on and so forth, as we are pretty much here within this community aware of within the Pharmageddon take. And if you aren't aware, then definitely do a little bit of looking up, and we will get you guys fully indoctrinated on that as well. But other than that, I wanted to report some of the facts that we do know from Pharmageddon. Shout out to, again, the accidental pharmacist there. He's the guy that's basically been doing really good at assembling all of this information for everybody countrywide. But check this out, in terms of who has been able to come forward about who was able to be a part of the walkouts. 200 plus walkouts, 390 shifts canceled, 99 Walgreens employees, 67 CVS employees, 119 pharmacists, 67 technicians, 43 out of 50 states participated. So very, very, very interesting. Only in Alaska, Hawaii, Idaho, Iowa, Vermont, West Virginia, and Wyoming, there was not any reports out there yet from those states about any pharmacists that did walk out. So very interesting there. Other than that, what we're talking about is cross-examining all that with the big box reports. And again, I'm going to show you the big box headlines just so everybody can see how wild this is. This is how they play war with David, and that's fine. Again, this is as of November 2nd. Pharmageddon, it appears, did not have the impact organizers said it would. CVS, Walgreens, both say pharmacist walkout had minimal impact. I'm not even going to read that. I'm just going to say how eye-rolling it is, right? What do you guys think? Let me show you this next tab. CVS profit beats estimates on strong performance of pharmacy operations. Again, hitting billion-dollar numbers better than they ever have before. 8% growth in revenue. CVS of $46.89 billion in the third quarter, partly driven in growth by specialty pharmacy again, and PBMs, which, yes, they own the specialty drug chain. They own everything between it all. It's on top of the supply chain. But you're seeing this, CVS profits are through the roof, and then you're seeing Pharmageddon and the outlook of the pharmacy industry as a whole right now, and the future of retail pharmacies being, completely up in the air. Independents, are fighting the hard battle. NPR has a good layout here, a 32-minute listen, saying, again, we already know pharmacists overworked, understaffed, again, doing too much, leading to literal jeopardizing of patient care. And those who don't support their pharmacists and understand this are really just going to be suffering on the back end, because you're going to go to different pharmacies, have an incredibly long wait time in line, so on and so forth, right, guys? We already know what happens in these kinds of stores. So speaking of that, Let's move on to Herbal Wellness Corner. Why is that important, you say? Well, guys, in the Herbal Wellness Corner, we're talking about today something, again, in the pharmacy industry that's big. And that is hydrocodone acetaminophen, or otherwise known as Norco, is currently out of stock basically everywhere. So what does that mean? People are in pain. People that are taking opioids are in pain. Do you remember? So for those of you who aren't really aware of the hydrocodone shortage, it's actually been going on silently, not being necessarily acknowledged, but now it's starting to really hit. And this is with increased scrutiny on the opioids and so on and so forth that continues to culminate into this. But now, again, hydrocodone 10-325, the higher strength of Norco is basically, almost about to be out everywhere. And this is bada bing, my time to enter cannabis. What a perfect time to talk about it, guys, because again, hydrocodone and oxycodone are not the same. Different morphine equivalencies to, morphine, so on and so forth, right? And when you talk about that, hydrocodone, Norco used to be Schedule 3 up until, I believe, 2014. So everybody, as we were saying, before that time was getting completely prescribed, things like Norco and pain meds all the way through the 80s, 90s, and now, right, when you're really thinking about all that. And it led to the United States being the biggest consumer of prescription opioids in the entire world. And as opposed to the ratio of the entire world, guys, we're consuming it for the entire world. The world doesn't even have to take any for us to consume it all. And it's, the numbers completely, reflect that. We'll share with you guys here. Again, Dr. Dustin Sulak, I love this because he hits every single nail on the head. America claims less than 5%, guys, of the world population, but consumes roughly 80% of the world's opioid supply. Nearly 50% of patients who took opioids for more than 30 days in the first year of use continued them for 3 years or longer, guys. And we're still got people that, have been doing this for a really long time. 80s, 90s, early 2000s, it was starting to be marketed that it was safe, that it was okay. This was the preferred thing for pain. Everybody wanted the quick fix, and now here we are. What do I want to discuss with that? Cannabis. Where does cannabis fall in there? Because cannabis helps people get off of opioids. And granted, you've probably heard me talk and go through these studies multiple times, and we're going to keep going through there, guys. But, when it comes to cannabis and harm reduction and cannabis and actually, using it to reduce opioids and replace, guys, it's doable. It literally helps to reduce opioid doses by at least 50%. Those of you who may be suffering from the opioid shortage right now, this is the perfect time to talk to your doctor about using cannabis because, hey, maybe your preferred opioid of use is out of stock now. Well, let's take that dose down. How are you going to do that, right? With cannabis, by this exact method right here. Take a small oral or oral mucosa dose. Cannabis with every dose of opioids can be as little as 1 milligram THC below psychoactive threshold. Even at low doses that do not cause impairment or adverse effects, cannabis can enhance the effects of opioid medications. Always use the lowest effective dose of cannabis to avoid building tolerance. Used inhaled cannabis for breakthrough symptoms, severe pain, flashbacks, panic attacks, withdrawal symptoms, etc., and to reduce cravings. Again, what else can cannabis be done for? Helping to enhance essential health promoting non-pharmacological activities such as savoring, exercise, meditation and prayer, journaling and reflecting, cognitive and behavioral therapies, right? You can help it to get regular sleep patterns, right? Hopefully you're using sedating strains. Select combinations of CBD and THC if available to enhance benefits and decrease side effects. 1-to-1 ratios, Farm True, you can get them at High Horse Cannabis Company. Sponsors of this segment here, Herbal Wellness Corner, the 1-to-1 ratio is broadly effective and well tolerated. Many patients prefer CBD in the day and THC dominant at night, but this is highly individual. So cannabis naive patients encouraged to take advantage of a 2-week window of opportunity after starting cannabis to reduce that opioid dose by 50 to 80%. Again, there's a healer.com 6-day cannabis sensitization program before starting the opioid taper, so on and so forth. But again, if you're at your wit's end with your pain meds, or you know somebody who is, you can really consider, guys, getting those opioid doses down by at least 50%, up to even 80%, guys, if you're affected by the Norco shortage. Perfect time to get off that crap anyways. So moving on, community spotlight. Tomorrow, everybody, is election day. Hope everybody has gotten out there and vote. If not, tomorrow's your last day to do it. Vote Las Cruces, guys. Hope you make a plan to get out there and do it. You know, what are you going to do? How are you registered to vote? Well, you can get it all taken care of in a one-stop shop there at City Hall or any of the other locations tomorrow. So got this up here in the corner. You can click the QR. It should get you right where you need to go in terms of the resource there. Clicking that just to flash it for y'all. And we'll take you to the screen as well. So again, Tuesday, November 11th, guys. Mayor, district councilor for 1, 2, 4, and municipal judge 1. City elections. Can't complain if you don't vote. Go get her done. Capiche? Have you voted? I don't want to know who, but have you? Right? Put that in the comments. What you got? What you got? So knock it out, baby. Anyways, last things for Men's Health Minute, guys, talking about early days of being a father. I share this with you guys here. Good information, I think, for our community here, because new dads navigating fatherhood's first steps, you know, as many books as you can read or whatever type of preparation you could ask for, guys. As I found out last week, you know, you got to go with the flow, and you got to understand what's going on. But, you know, what, as a father, not the mother, have I kind of come to learn about being, you know, a supportive person that's trying to support now multiple people, and especially the growth of one, and trying to be a part of a team for all of that. So I think it's cool to look at some of these other tips about it. You know, sometimes you get different takes from different people. Obviously, everybody's grown up and done their own things their own way, and that's totally with all respect. But, you know, for people like me, I definitely think the handling is scary still. Even a week in, I'm still feel like she's so fragile and so little, you know, responding and seeing cues for sure, you know, working and trying to make sure everything with my partner Jeannie and everything is up to speed. That's the balancing act to make sure that we can really achieve what we got to achieve there in terms of, you know, getting to a point of raising a little person. And so it's such a beautiful thing. So new dads, guys, you know, there's so many things there to think about, but I think it's good to acknowledge, hey, don't be overwhelmed, just lean into it and do what you got to do. And, you know, fortunately, you've seen not all fathers stick around and things like that. So I want to be one of those dads that, you know, is willing to share and talk about things so that you don't have to be so scared of being a dad, right? Whatever that may be.
I think any tip to a new dad from me would be to really kind of have confidence and get involved from day one. I think there's a tendency to kind of sit back as a new dad and not get involved and rely on other people. But I think the quicker you kind of get involved, the quicker you build confidence and also bond with your baby.
I think it's important that you appreciate that your partner's under a lot of pressure dealing with this new life, usually a little more than the dad is, and you should try and help alleviate that pressure, I think, by getting really stuck in beyond the paternity leave. Make sure you're the one preparing evening meals, make sure you're the one giving bath time and story time, make sure that your partner has a bit of a break and you're the one who should be offering that opportunity for them to rest. Look out for their welfare. I think that's an important job.
Sleep as much as possible, even if it's 2 o'clock in the afternoon. If you can just get your head down for a couple of hours, it will help you in the long run. Yeah, just sleep as much as you possibly can. Whenever he sleeps, you try and sleep as well.
I think it's important to keep a balanced life, so make sure you do the right thing at home, but don't suddenly put the rest of your life on hold. The baby can't take over everything. You've got to look after your new son or daughter, but you've got to make sure you have a bit of me time as well. So don't forget about that. Do some of the things you enjoy, build that in, find a way to build that in.
Well, be supportive for the partner. I mean, your partner's been through a lot. And try to enjoy the time with the baby. For a dad, it's a bit interesting because a newborn doesn't respond very much. So, but you soon get some smiles back, which is really, really nice, really lovely. And then the bonding goes much easier and is just amazing now. Really amazing.
Anyways, right, guys, I mean, you watch as many videos and things about parenting, but everybody's got their own story, and it's a very miraculous, awesome, beautiful thing. And my first week into it, I'm excited to keep chipping away at trying to make the world a little bit of a better place each and every single day. And that's what we did. First episode back Monday, November 6th, 2023. I hope everybody has a great rest of their evening. We'll see you guys tomorrow.